Hello everybody, I'm Dr. Jordan Taylor, Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. I'm here with Dr. Trent Herda, Professor at the University of Kansas and Director of the Neuromechanics Laboratory. We're going to provide a tour of his lab, discuss the type of research conducted in the lab, and talk about some of the equipment and instruments that are used in this lab for research purposes. All right, Dr. Herda, so what type of research is conducted here in the Neuromechanics Lab at KU, and then why is this research important?
Yeah, so it's best classified as neuromuscular. So we're looking at your brain-muscle communication. So in a lot of our experiments, if we see changes in the muscle, whether you're lifting weights or maybe you're inactive, it'll change how our brain communicates with the muscle. Ultimately, it will change how we perform physical performance tasks. So if someone has muscle disuse, it might mean that they need more neural activation to the muscle to complete the same task as someone who might have a stronger muscle who is an exerciser. So we like to look at resistance training or endurance training and see how that might change that communication. Also, in muscles with inactivity, inactive children or disuse or aging, where maybe the skeletal muscle is not quite as strong as it once was. It started getting a poor composition, more fat in the muscle. It's also going to change how we complete these tasks.
Yeah, it's amazing because I know you have some research out there looking at, intramuscular fat accumulation in youth and how it looks like that's changing some of the neural, firing patterns, motor unit recruitment, how the nervous system functions as a result of just that inactivity and that fat that's accumulating in the muscle. So it's kind of interesting. Do any older adult studies or anything?
We have a lot in the past. Our studies in younger children really are not that much different than our aging studies.
Right.
It's the same thing. Skeletal muscle, if it's not used often, fat tends to get in it. So we call that a poor composition. And when that happens, the communication between the brain and muscle starts changing a little bit. It makes it more difficult for them to complete typical tasks that maybe a healthier muscle can complete. So the take home is, so what? Well, carrying groceries becomes difficult.
Right.
Going upstairs, downstairs, more difficult if that muscle's becoming a little poor composition-wise. Right. And it really, fatigue starts to become an issue because they need more neural activation to do the same task as someone who's younger or maybe has a healthier muscle.
Right. So there's fatigue, maybe force output, all of this. It's like the muscle can only respond to what the nervous system is telling it to do.
Correct. And the big thrust, and not just my lab, but other labs, is muscle is very plastic. Mm-hmm. It changes quickly to the loads placed on it. So if there's no load, it's adapting to that. If there is certain loads placed on the muscle, like lifting weights, it's going to adapt to that fairly quickly. Same with cycling. So cycling training changes the muscle different than resistance training might.
Right. And it's interesting because, of course, it's cliche, but we hear it, if you don't use it, you lose it. So, of course, muscle tissue shrinks, it atrophies with disuse, with aging, things like that. But also the forgotten component is those motor neurons, those neurons and nerves that connect to the muscle tissue, there's changes there within the firing of those and how the nervous system works with this disuse, this atrophy, the accumulation of intramuscular fat, the sedentary lifestyle, and then differences, like you said, in are you doing resistance training? Are you doing more cardiovascular training? How does that affect the neuromuscular system? So
yeah, and the really scary part is we're seeing the use it or lose it in 8 and 9-year-old children.
Yeah.
So physical inactivity is changing the environment in their muscle where their neural motor unit activation patterns are different. They're having a harder time recruiting motor units. That's pretty scary at that age to maybe have those struggles because it's only going to make it more difficult without significant intervention to tap into their strongest motor units, their strongest muscle fibers later in life.
Yeah, when he says children are having difficulty kind of recruiting or tapping into those motor units, a motor unit is just one motor neuron, which is basically a nerve that leaves the spinal cord and then connects with muscle fibers in a specific muscle group. So if you're having trouble recruiting that and turning on that nerve, then you're obviously going to have trouble activating your muscle tissue to produce force, to use that muscle tissue to do daily tasks or exercise or whatever. So
yeah, it's no different than bone. I always like to bring up bone because I think we can see this easier. If you have weak bones as a child, you're more likely to have fractures. Mm-hmm. Weak bones as a child without some type of intervention means you have weak bones as an older adult. Even easier to fracture. As we age, bones become weaker.
Yeah.
So they're getting into this area, the disability zone, where fractures can occur easily or easier just based on what their bone health is as a child. It's no different with skeletal muscle.
Right, right. All right, Dr. Herda, so what do you measure in the lab? What types of equipment and instrumentation are used for conducting your research studies? So maybe talk about what this setup is here.
So the first big piece of equipment that we use often in the lab is a dynamometer. So isokinetic dynamometer allows us to measure the strength of almost any muscle that we need to, but it also sets the muscle action. And we'll talk about here in a little bit. We'll first do isometric muscle actions, and then we're going to do isokinetic muscle actions. So this machine you'll see in physical therapy clinics. You might see in sports science type research too. We can set the muscle action, measure any strength from any muscle in the body, and then we're also going to put sensors on the leg when they're on this machine to measure that neural activation that we were talking about.
Dr. Herda, could you explain too, what's the difference between isometric and an isokinetic?
Yep. So we're going to do that. Our first test we're going to do is isometric, is where the foot is not going to actually move. The leg is not actually going to move. So our subject will push out, and you'll see his foot will not kick out. The leather arm will hold his foot right there, but we'll be measuring the strength output of his quadriceps muscle. And we like to measure, test the thigh muscles. Our thigh muscles are really important for physical performance. If we have a healthy thigh muscle, we're probably a pretty healthy individual. If our thigh muscles aren't very healthy, we're not a very healthy individual, even like discussing insulin resistance, cardiovascular health. So our thigh muscles, our muscles of our upper leg are usually pretty good indicators of our overall health. So the first test we're going to do is how we look at neural activation. So we can record motor units from the surface of the skin, and that requires isometric muscle actions. It also requires our subjects to trace templates. So this is something that our subjects will practice prior to the real testing session, and we'll just roll through it right here. So you probably can't see it from there, but he has sensors on his legs. He's got one on his knee. He's got a sensor on one of his thigh muscles that's going to measure neural activation at the level of the muscle. All right, you ready?
Yep.
So this first test is isometric. We're going to ask him to push out as hard as he can. And then from there, we'll take that strength number and create this template on the computer screen. On this computer screen, when he's pushing out, you might see a bar graph on there go higher and lower. That is his strength output. All right, so just relax, relax, relax. Ready, set, push, 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 and relax. See, Dr. Herda messed up here. Isometric. That was not isometric what he just did. So we are going to do isokinetic contractions here in a second, and now it's still in isokinetic mode. So now this will be an isometric contraction. Are we ready?
Yep.
Ready, set, push, 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 and relax.
Again, you can see he's producing force. There's no change in the joint angle because it is isometric. So the thigh muscle, quadricep, it is contracting. He's producing force, but joint angle is not changing.
Yeah, so you notice I have a cadence. The best part about this lab is every tester, every student has their own cadence. We want to give strong verbal encouragement. If this wasn't a video, I would have been much louder, but we want them to give maximum effort in that type of test. So this next test is going to take 50% of his total strength and plot this template on the screen. He's going to trace the template. This is how we standardize that communication from the brain to the muscle across participants. And this is where we're going to look at neural activation. So in this template, just be thinking about before and after lifting weights, before and after a cycling program. Our brain is going to do this task differently. Our neural activation is going to change while doing this task. Or if you're someone who's maybe inactive versus active.
Neurological adaptations specific to the type of training you do.
You see this template, you see his force output, and he's going to trace the template as best he can. And we do tend to have a practice session prior to completing this task. And then slowly come down. And the tracing down the baseline is usually the hardest part. And relax. So that is how we standardize that communication from the brain to the muscles so we can compare across individuals, before and after interventions. And that task right there is how we get neural activation. The next test that we're going to do is the isokinetic testing.
All right, Dr. Herda, so you just finished this isometric testing. Can you explain to us what this output data means?
Yep, so this is the information from that sensor that's on his quadricep. First of all, the black line is their strength output of the thigh muscle. These rows with vertical dashes, those are the exponential trains, the firing rates of the motor units that we recorded. The totality of all these lines, these exponential amplitudes, and how often they fire tells us neural activation. So for this contraction, after resistance training or after cycling intervention, his neural activation might go higher or might go lower depending on how we're changing the environment in the muscle. Typically, if it's a muscle that's a little less healthy, we don't see the level of neural activation that we do in a healthy muscle, someone who is an exerciser or performs a lot of physical activity. And this last thing here, a lot of this information on this screen is strongly associated with the fiber sizes and the types of fibers that you have in the muscle, type 1 fibers versus type 2 fibers. So with training, you typically change that ratio, and then we're going to see that change happen at the level of the brain also.
And again, just remember when Dr. Herda says motor unit, that's a nerve. You can think of this as like an electrical wire in your body that innervates or connects to multiple muscle fibers. So however many muscle fibers are connected to that motor neuron, that nerve, that's your motor unit, right? And so one motor neuron, one nerve could connect to as many as 15 fibers, muscle fibers in a small muscle group, like say muscles that control the eye, or in a large muscle group like the quadricep here, you may have one of those nerves, those motor neurons, connecting to 500, 1,000 fibers, right?
Yep, and we'll because of that, we'll test different muscles. Right now we're set up for the thighs, and we do test these muscles very often, but we'll actually test muscles of the hand if we have different questions, because the motor units are so different in the hand versus the thigh or quadriceps muscles. Another very popular test in neuromuscular labs is isokinetic testing. So we're going to see how strong he is at different velocities. Right. So the faster he has to kick out, he will be weaker. We also find this test strongly associates with disability and physical performance. So individuals at slow speeds might be pretty strong, but as we ask them to do something faster, they become weaker and weaker. That tends to happen in individuals who maybe have atrophy or they're inactive. And strength at fast velocities is what we need to regain balance when we're tripping. Go upstairs, do those types of things. So it's an important. So what we're going to show you now is a very, what we call probably the gold standard for testing physical performance of an individual.
And it makes me think of older adults, elderly. You use the ability to produce powerful, explosive movements, especially if you're out of shape and inactive, because you lose some of the what are called fast twitch motor units, right, as you age. But remaining physically active, doing explosive exercise, which you may not think about as you age, that actually helps to maintain those fast twitch motor units, and it allows you to produce fast, powerful, forceful contractions, right? And
yep.
You lose that as you age if you're not doing some sort of explosive activity.
Yep. So this is an easy way to test that in an individual to see how healthy they are at faster velocities. If they don't do a great job, they're more at risk for falling, etc.
Right.
So, all right.
Let's check it out.
All right. Ready, set. Push, 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 and relax. Push, 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 push. Relax. One more time. Push, 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 and relax. All right. What we see on this screen is you can see his leg moving here. This is the position. You see the velocity at which his leg is moving, and then you see the strength output at that velocity. So the faster we ask him to push, we increase the velocity, his strength is going to become lower. And if you're someone who is inactive, it's going to be even a worse problem for that person. So this is isokinetic testing. That's just at one speed, but we'll do that at various speeds in a lot of our research.
All right, so we brought in Jeremy Pearson here to Dr. Herda's Neuromechanics Lab, and we got Moise, our senior exercise science student, on the table. So Jeremy's going to be doing an ultrasound of the right thigh, looking at the vastus lateralis, the outer quadricep muscle. And so ultrasound is just you're using sound waves to generate an image of the muscle. Ready to go?
In any project where we look at neural activation of a muscle, we're going to record the image of the muscle with the ultrasound, and this image will give us the size of the muscle. Also, the color of the muscle on the image tells us a little bit about the fat in the muscle or the non-contractile tissue in the muscle. So anytime we do an intervention, we'll do this pre and post, we'll see changes in the size, or maybe not, or changes in the composition of the muscle, and we'll have corresponding changes in neural activation to the muscle. So doing this procedure tells us, a lot of times will let us know how the neural activation of the muscle will change depending on how their muscle looks with the ultrasound. So it's pretty simple. Here we have an image of the VL, one of the quadriceps muscles that we typically test. And can you show Jeremy just with your fingers, just a quick outline?
Definitely. So what we're looking at here on top, here's just kind of the outline of the dimensions. Right on top here you can see yellow tasks or tick bars. On the bottom below that we have skin. Below that we have subcutaneous fat. And then the white is the muscle fascia. So the fascia is what I like to call the blanket of the muscle. Right below that we have all of the muscle tissue kind of wrapping around, and that white fascia is encapsulating that. Below that we have more fascia, more muscle, and then right below here you can see the bone, which is the femur.
Yep, so any intervention, that picture will change, and we'll see corresponding changes with the neural activation testing we showed you.
Yeah. See things like changes in the amount of fat that's in the muscle, maybe more or less. Obviously, you would probably expect less fat to be inside that muscle if you're more physically active, right? If you're eating healthier. If you're doing resistance training, you're probably going to expect to see some muscle hypertrophy, right? Larger muscle fiber. And then if you retested them on the dynamometer, which Moise was on previously, you'd see some changes there in neural activation possibly, and some of those patterns with the isokinetic and isometric testing.
Yeah, so you've seen neuromuscular testing. This is the muscular. You saw the neural testing with the isometric and a combination of both with isokinetic testing. So.
And I guess maybe we'll get into these last few questions. So can you talk about, grab my list here, I'm trying to remember the exact question, but some of your favorite studies that have been conducted in the lab, and then what were the findings of those studies? I don't know, maybe just highlight one or two.
Yeah, I like the strength training studies we've done, whether in older adults or college age kids. In the college age kids, when we do strength training, the muscle grows. We see the muscle grow on the ultrasound images, but we actually don't see changes in neural activation. So it's telling us they're getting stronger primarily because their muscle's growing and their brain is not communicating differently with them. The opposite, with children in our strength training projects, we see their muscles don't grow like this. They're getting stronger, but their muscles aren't growing as measured with the ultrasound.
So it's like the nervous system is sending a stronger signal to the muscle, right? We get into terms like motor unit recruitment and firing rate. So it's the nervous system is activating the muscle differently in youth that have underwent 8 weeks of resistance training, say.
So we'll see their neural activation really increase with our other testing. Other things I think are very interesting. Children in general have lower neural activation than adults. So the neural testing, they have much lower firing rates of the motor units than adults do. As they go through puberty, they start to approach to what a typical adult would have for neural activation. So we see that quite a bit too. And also the last thing I'll mention is we see sex-related differences. On average, males tend to have larger CSAs, muscles than females. Not always the case, but on average, yes. We also see neural activation differences performing high-level physical performance tasks or high-intensity physical performance tasks between males and females, on average again. But low-intensity tasks, they basically have a similar neural activation.
That's interesting.
Yeah, so it's task-dependent. Lower level, low-load tasks, neural activation seems to be very similar, but as we head to a higher intensity task, neural activation does differ.
Right, like plyometrics, things like that, sprinting. Yeah, okay.
So it is task-dependent.
Right. And I guess as far as future research studies, what do you want to investigate in your lab? Any future directions you want to talk about?
Continue on with the children. We do the ultrasound scans with children, but now at the Med Center, we get better images of the lipids in the muscle with MRI. So that's a thrust. Also starting to connect the changes we see, the neuromuscular changes we see with metabolic changes. So if we do training and we're seeing less lipids in the muscle post-training, that also should mean they're becoming more insulin sensitive.
Right.
So we're starting to make those connections, which we haven't done.
Which is important for those of you that struggle with, diabetes, insulin resistance, like type 2 diabetes. Your cells are resistant to the action of insulin. They don't want to listen to it. What does insulin do? If you're insulin sensitive, insulin's going to help clear sugar out of the bloodstream, get that sugar into your liver, your muscles, your fat cells, But like you said, if you're accumulating a lot of intramuscular fat, abdominal fat throughout the body, your cells don't want to listen to insulin. And so insulin levels will be really high in the blood, but blood sugar stays high because the cells are not listening to insulin, right? So it's kind of interesting how what's going on in the muscle affects your metabolic health. And this has, huge implications for people if you're struggling with insulin resistance, which is a hallmark feature of type 2 diabetes. And it's really cool what you're finding.
Less discussed is neuroactivation is a component of insulin sensitivity. So if your neuroactivation goes up, your fibers are firing more often, and they're going to be able to use more glucose.
Right.
So it's something that's less discussed. So neuroactivation is a big part of insulin sensitivity.
Right. So you think you get more neural activation, and you're more insulin sensitive, and less insulin resistant. Poor neural activation patterns, more intramuscular lipid, more intramuscular fat. You're more insulin resistant, less sensitive, and you're more likely to have those higher blood sugar levels.
Yeah,
That's
so I say we're probably one of the very few labs that have probably made that connection with neural activation in the metabolic disease realm.
That is interesting. That's really cool. Anything else you want to mention about your lab?
We're always welcoming of undergrads as researchers, so it's a fairly informal process. I get a lot of emails every semester. They're always asking if we have to, do an application, complete an application. No, just reach out to us. But undergrads are always helping us with our projects.
Yeah, and for you undergrads, because a lot of our exercise science students are going a lot of directions. So Moise, I pronounced it right, Moise? Yeah. Because I don't think I've had you in one of my classes before. I'm not sure. But Moise is looking at pre-med. He wants to go to medical school. So doing things like this, getting involved in the lab as a subject, or maybe you learn, I have undergrads that have learned how to do ultrasound, right? So you learn some of the lab techniques, you become a subject, you get familiar with how research is done, and you can put that on your CV or your resume, and it looks good for those committees when you're applying to medical school or physical therapy school or occupational therapy or PA school. I mean, we have students going in all different directions, some going into personal training, strength and conditioning, but all this is just resume building stuff. So, take advantage of your time at KU. If you're a student, it's not just about getting good grades and, getting that A on your transcript, but there's a lot of opportunities to really get involved in some cool stuff here, and you should enjoy learning it. And that should be a bigger part, I think, focus of not just getting the grade, but really there's cool stuff in these labs. You can get involved, and it really boosts your CV and your resume, and it makes you a more well-rounded student prior to you either going out into the workforce or going on to graduate school. How can people contact you if they have questions about your lab, your teaching, or your research?
Yeah, the best way is email t.herda@ku.edu to check out the research we do conduct in the lab. Please go to the Google Scholar page, my Google Scholar page.
Yeah, and if you have questions for me about the KU Exercise Science program, you can contact me through email, jtaylor@ku.edu, or call my office phone at 913-897-8516. Thanks again for watching.